As I mentioned, I'm Peta, and I'm very passionate about volunteering, both personally and in my role at Dudley Council, where I coordinate the Health of Communities Volunteer Programme and Community Health Champions programmes in public health. The formal volunteer programme has been running for over 10 years, and it's a formal programme that offers opportunities for local people to get involved in their community, sharing their skills, their experiences and their passions, and improving health and wellbeing. With a whole range of roles across our different areas: stop smoking, healthy eating, weight management, physical activity, breastfeeding and the self-management programmes. And all of our volunteers are trained and supported in those roles. Last year our programme received the Investing Volunteers Award, which was fantastic. And going through that process has really helped us demonstrate the ways in which we're following best practice, and also that our programme is really valued by our volunteers. The Community Health Champions programme is much more informal. Members of the community who've taken part in public health projects are given the opportunity to become Community Health Champions. Our Community Health Champions, or CHCs as they get shortened to, describe themselves as informal messengers in their communities, and they're individually supported to shape their own roles. They do things like talking to their families, friends, colleagues and neighbours. They share health information and resources, and some have gone on and organised community events and developed their own project ideas. 3 of our CHCs recently received an award at the Celebrating Public Health Excellence event at the House of Commons for the work that they've been doing with taxi drivers across the Dudley Borough. In terms of talking about volunteering, there's one thing I'm just going to get out of the way very quickly, is that there's no single agreed definition for volunteering in the UK. And there's lots of debate about the definitions and the terms and what we call volunteers. The definition that was adopted for the Compact and the core principles embodied in volunteering by the United Nations describe it as someone who gives their time freely, but acknowledging that people will have very different reasons for choosing to volunteer. They do it to benefit others, but they will benefit themselves. And they do it without expectation of financial reward, but they may be rewarded in lots of other ways. For me, this variety of definitions and terms and roles just evidences the fantastic diversity that there is of volunteering that exists, and one size does not fit all. And as Debs has mentioned earlier, we are really lucky in Dudley to have a really thriving and diverse voluntary community and faith sector. Within Dudley Council, there are areas such as housing support, the libraries, the physical activities, sports development, parks and leisure, and also Queen's Cross, for example, that are all finding really innovative ways of involving volunteers in what they do. For me, volunteering is about a reciprocal relationship. It's a two-way positive relationship, an exchange. And some of the key things for me are about understanding people's different motivations for volunteering and getting involved. How we can best support and manage their passions and their skills and their experience. And finding out where are those opportunities for them to have the most meaningful impact. In terms of the evidence, there's a wealth of evidence and research that explores the benefits of volunteering and demonstrating that it can have a positive impact for individuals, for organisations and for the community. Benefits for volunteers themselves include things like that sense of achievement and personal satisfaction, what's been termed the helper's high, that good buzz you get. They also gain really useful skills, they build confidence, they gain experience, and they get personal and social development. They make new friends and contacts. Volunteering can also be a stepping stone for them into further training and employment, and has been shown to improve people's physical and mental health and well-being. A survey of 3,000 volunteers found that 85% of them reported enhanced well-being after volunteering, and give is one of the 5 ways to well-being. The physical benefits include things like lower blood pressure, reduced stress, a boosted immune system, and this can help reduce the risk of disability and mortality, longer life expectancy compared to people who don't volunteer. Some of the effects on physical health were most noticeable in older volunteers, and that's related to them being more active and being more connected. Many studies have also reported lower levels of depression for people who volunteer. Again, because volunteering connects people and reduces feelings of loneliness, which was talked about earlier. In a national survey, 86% of volunteers found that meeting people, making friends, was a really important benefit to volunteering. And this was one of the things that was most mentioned by our volunteers in their interviews with our Investing in Volunteers award assessor. They also talked a lot about the opportunity to mix with a really diverse range of people. On these next couple of slides, I've just put some quotes from our volunteers, which will hopefully help illustrate some of the things that I'm talking about from their perspective. Volunteers can motivate, empower and support others. With their passion, their personal experiences and their skills, they're role models and they're people that can really relate to them and identify with them. The Altogether Better programme in the north of England found that their community health champions' life experience and ability to relate to others enabled them to share health messages, remove barriers and create supportive networks. As part of the community, they understand the way that the people that they work with, and they communicate them in a really friendly and accessible way. They get close to people in a way that professionals can't. And in their work with the taxi drivers, our community health champions were able to really quickly develop that trust and relationship with the taxi drivers, which as professionals going in would have found really difficult to do. This community health champion model in the evaluation from Altogether Better was considered to be a really effective way of tackling health inequalities and something that could be applied across different health issues and different health settings. In terms of the benefits it can bring to organisations, volunteers add value to, they enhance and extend the programmes or services that we can offer. And as I said, they bring something that paid staff cannot bring. People who give their time to support our work demonstrate to others that what we do is really valued by the local population. Working with volunteers also provides opportunities for staff to develop their own skills and gain a better understanding of their community. And they bring a really important different perspective to the work that we do. And the input from our volunteers has really helped to improve our services and the things that we do. Some examples. The language skills of our volunteers have increased the community access to our programmes and health information. They've identified new opportunities and for roles and projects that can help them use their strengths to have an impact. They've shaped our volunteer involvement policy and the way that we communicate, helped design our website and our evaluation tools, and supported decision-making panels and interviews. They're also part of all of our programme planning meetings. They support new volunteers, and some of them have been supported to go on and become sessional workers or providers of our community courses. Our training programmes provide opportunities for everyone to share and develop their skills and knowledge and learn from each other. And we've also invited volunteers from other areas to join these sessions and found it's a really great way for them to connect with others, find out more about what they all do in Dudley, share their knowledge, learn from each other, but also feel part of something bigger. Our volunteers have also developed sort of harder vocational skills like increased knowledge and accredited qualifications like the OCN certificate for our breastfeeding training, but also those softer skills, self-confidence, self-esteem, interpersonal skills. And these things all help contribute to workforce development. We signpost all of our volunteers to development opportunities that are outside of our programmes and also to job opportunities. Many of our volunteers have gone on and gained employment in related areas: health trainers, park activators, wellbeing mentoring projects, food growing programmes, the breastfeeding helpline, stop smoking and alcohol treatment services. Many of these benefits also contribute to our stronger and safer communities. That volunteering enables participants to feel more connected, and they tend to develop wider networks and become more trusting and participate more. They also tend to have a more positive view of their local community or neighbourhood. Bringing people together from different backgrounds through volunteering also helps to challenge the stereotypes and misunderstandings. For example, people with disabilities can sometimes be thought of as service users, but this view can be changed through voluntary involvement. As Queen's Cross have demonstrated, their active involvement of clients has resulted in a user-led organisation being set up and disabled people leading activities for each other. summing up then, over the last 10 or 12 years, looking back through the literature, there's been a whole range of government documents that have supported greater public involvement as a way of tackling health inequalities, reducing public expenditure and delivering better health outcomes. Somebody called Holland had a theory of volunteerism, and he suggested that people will seek out environments that allow them to use their skills and abilities to express their attitudes and values. And this is something we need to enable and allow people to do, and links in with the community council approach about thinking about what are those things that we need to do and what are those things that we can enable the community to take more control of for themselves. If we do want to involve volunteers and ensure that their contribution has the maximum impact, then we do need to make sure that we think about a few key things. A systematic review of Volunteering England reported that the contextual factors such as how well volunteers are trained, managed and supported are critical in achieving positive outcomes. Regular and effective communication with professionals, opportunities for volunteers to meet others and share their experience were also really important. This connecting also helps them to develop ownership and can lead to successful schemes that are run and administered by volunteers with very little input from statutory organisations, such as the Walking for Health programmes. From my experience involving volunteers, it can bring a whole range of positive outcomes, provided that we invest in their support and development and value them and what they do. This volunteer involvement is just one of the ways in which we can work more collaboratively with communities. And I'm sure that you've already heard about and will hear about lots more opportunities today. Thank you very much.
Are there any questions for Peter?
I was going to ask, how many, if on average age group, volunteers you put on the field?
In terms of our programme, right across the age range, we've got, I'm trying to think, our oldest volunteer is probably in her late 70s, and we've got people in their early 20s. I'm not sure if we've got any younger. I have got the last report on the demographics from the database the last time we did it, so I can have a look if you want.
All I was thinking of is obviously we've got Stourbridge College in Stourbridge, which has got a strong public service course. It's also got strong health and technical courses. There was a way to tap into those people who are learning and get them to volunteer to work.
Yeah, that's definitely an area that we can look at, and moving forward. I do often have inquiries from volunteers. I think sometimes the difference is that if they're looking for something to do over the summer, the things that we do, because they're by their nature longer term, they need to have the programmes run over a period of time, and for them to get the benefit of seeing what we do, they need to volunteer for a bit longer. But obviously we have got students at universities and colleges who are volunteering with us.
And the CCG is also looking at a programme of young health champions, youth health champions. We mentioned, Peter mentioned that we've got those community health champions. We're also looking at how we can work and train young people to work as health champions for other young people. So maybe if you're from college, maybe that's the sort of thing that we're achieving. I think we've got quite a strong programme of making sure people are trained before they go out particularly around specific health issues. We make sure that people are trained in the CRB check before we do that. Peter will know more than that. We've actually won an award for the processes that we've got in place for our volunteer programme. It makes it very robust.
Very much depends on what they're going to be doing. And there is new guidance that's recently been released to try and reduce some of those barriers that are stopping people volunteering. Because we seem to have gone down a route where you had to be checked to do anything. And they have relaxed that. In terms of our programme, obviously we do have a process of checks, because if you're going to be supporting a mum to breastfeed or doing something that's actually quite personal, then obviously you do need to have that level of check. But it will depend on your roles and the way they're working, where they're working and who they're working with. And there's lots of guidance available on the internet and places like Volunteering England. in their Good Practice Bank have got lots of really useful resources about that can kind of help you with those kind of issues. That's helpful.
Yeah, thanks for the presentation and congratulations to your notes. The question is in relation to, I suppose, gathering the evidence that you've got up there and the impact of what you're doing. So, just take the smoking cessation for an example, the breastfeeding. Are you measuring the impact that you're making because of the volunteers? So, how much have you reduced or increased breastfeeding or decreased smoking?
It's one of the biggest challenges, and it's also where the debate about what we volunteer terms and definitions, because in collecting all the evidence, there's so many different programmes, it's really difficult to say that research from one particular programme would necessarily relate to every volunteer programme that's out there, because of the spectrum of them. And it is also a challenge in how you capture that sort of evaluation. And that was the only really recommendation from our reward assessment, was she said, I know from all the people I've talked to that you're capturing outcomes here that you're probably not capturing, and you really need to look at that. So that's on my hit list for this year. We do capture a lot. I've got some case studies from lots of our volunteers that tell their really personal stories and the ways in which volunteering has benefited them and the things that they've done for their community. If you're interested, by all means, have a look at these and take them away with you. And we also collect the more quantitative stuff around the hours, the number of interactions they have, where they go, the different things that they're doing, as well as some demographic stuff around are they looking for work, when they came into the programme, did they find a job, all those kinds of things, and some of the qualitative stuff around them reporting their increased confidence and things like that.
Okay, thank you. Any more? Right, thanks, Peter. Thank you very much.